The anterior cruciate ligament, or ACL, is a vital ligament in the knee that provides stability during movement. An ACL injury, often a tear, typically occurs during sports or activities involving sudden stops or changes in direction. When an ACL tear happens, it can cause pain, instability, and difficulty with activities. ACL reconstruction surgery is often recommended to restore knee stability and function. This procedure involves replacing the torn ACL with a graft, usually taken from another tendon in the body. Surgery is often the best course of action to regain full knee function and return to desired activity levels. Following post-surgery guidelines provided by your medical team is essential for a successful ACL reconstruction recovery. These guidelines are designed to minimize complications, promote healing, and optimize knee function. It is not merely a suggestion, but a critical aspect of the healing process to adhere to these recommendations diligently. These guidelines often include instructions on wound care, pain management, medication usage, and activity restrictions. By following these guidelines, you actively participate in your recovery and contribute to the best possible outcome. Ignoring medical advice can lead to complications, prolonged healing times, and potentially compromise the success of the surgery. Remember, your medical team is there to support you throughout your recovery. They can address your concerns, monitor your progress, and make necessary adjustments to your rehabilitation plan. Open communication with your healthcare providers is key to addressing any questions or concerns that may arise during your recovery journey. Physical therapy plays a crucial role in regaining strength, flexibility, and stability after ACL reconstruction. It is an integral part of the rehabilitation process and is essential for achieving optimal outcomes. A qualified physical therapist will guide you through a personalized exercise program tailored to your specific needs and progress. Early exercises typically focus on range of motion movements to prevent stiffness and improve knee flexion and extension. As healing progresses, strengthening exercises are gradually introduced to target the muscles surrounding the knee joint, including the quadriceps, hamstrings, and calf muscles. Examples of strengthening exercises include straight leg raises, quadriceps contractions, and hamstring curls. These exercises help rebuild muscle strength and improve knee stability. Your physical therapist will guide you on the appropriate exercises, proper form, and the right pace to progress without overexerting your knee. Section 4. Rest, ice, and support for healing. Rest, ice, and support are crucial in ACL recovery. They minimize pain, reduce inflammation, and aid healing. Rest focuses energy on repairing tissues. Avoid activities that stress the knee. Ice reduces swelling and numbs pain. Support with crutches or a brace protects the knee. Section 5. Lifestyle choices for optimal recovery. Your lifestyle choices can significantly impact your ACL reconstruction recovery. Maintaining a healthy weight, eating a balanced diet, and avoiding smoking and excessive alcohol consumption are essential factors that can influence healing and long-term outcomes. Maintaining a healthy weight reduces stress on the knee joint, making it easier to regain strength and mobility. Excess weight puts additional strain on the recovering tissues, potentially hindering healing. A balanced diet, rich in fruits, vegetables, lean proteins, and whole grains, provides the necessary nutrients for tissue repair and overall health. Smoking and excessive alcohol consumption can impede healing by interfering with blood flow and delaying tissue regeneration. Quitting smoking and moderating alcohol intake are essential steps toward optimizing your recovery potential. Section 6. Mental health and long-term outlook. Recovering from ACL reconstruction can be a challenging journey both physically and mentally. It is crucial to address the mental and emotional aspects of recovery alongside physical rehabilitation. Patience, support, and a positive mindset are essential for navigating the ups and downs of the healing process. It is normal to experience a range of emotions, including frustration, anxiety, and even sadness during recovery. These feelings are valid, and it is crucial to acknowledge and address them. Seek support from your loved ones, friends, or a mental health professional if needed. Remember that recovery is a marathon, not a sprint. Focus on celebrating small victories along the way and trust the process. By actively participating in your rehabilitation, making healthy lifestyle choices, and nurturing your mental well-being, you can optimize your chances of a successful and fulfilling recovery.